This segment is proudly sponsored by Zbrana Productions.
10:33 RB2, your station of choice. Good morning to you, Dr. Baggett.
Good morning. How are you?
I'm very well, thank you, sir. How are you?
Wonderful, wonderful. I see winter is slowly coming to an end.
It is. Yesterday I got a chance to wear a dress without stockings underneath. So, yeah, definitely. We're getting there.
Well, it's been a chilly one, and unfortunately, actually, from a medical perspective, we've not seen too much flu. I said this winter, although it's been chilly, not many flu cases. So I think we're blessed in some way because it's been very cold during some of the months.
I choose to disagree with you there because I'm one of the people that struggled with flu this season more than any other years. This time around for me it was bad. Anyway, let's get on to it and welcome to RB2 today. Welcome to the brunch on a Saturday. Now, I told you earlier on that my name is Bant. I'm standing in for Thato Zandile. I believe that we'll work along together in a way that you expect.
Indeed, we're just continuing our series where we're listing right at the beginning of the Broken Body series the commonest causes of death and hospital admission worldwide, and the top disease around the world, from which Botswana is no exception. Last week we talked about blood pressure, what it is, how to detect it, why it's important to treat it and how to prevent it. And today we're going to be talking about what are the consequences of high blood pressure, and that is stroke. And stroke, is a frightening term for a lot of people. I think almost everybody out there knows somebody, either in the family or relatives or neighbors who've had a stroke. And we need to understand exactly what a stroke is so that people understand. The most important thing is that a stroke is an emergency. It's a medical emergency that occurs. Why does it occur? It occurs because the blood supply to the brain is interrupted or sometimes severely reduced. And this can cause brain cells, if you like, to die, leading to a range of symptoms that depending on where the stroke is, it can affect all sorts of things. So that's really the most important thing to understand, that it really is a medical emergency. And you need to seek attention. And before you jump into any questions, I think the most important thing for people to understand there when they want to recognize what a stroke is to go through a number of questions they're asking. They're looking at somebody that they think, you know what, kind of this guy is having a stroke. You ask, are you getting sudden numbness or weakness on one side of the body? Sort of bohatsu, if you like. Are you getting sudden confusion? Are you having trouble speaking or understanding? So you're talking to somebody and you find that their speech is garbled, or it's not coming out right, or the saliva is drooping from their mouth, or the mouth has turned to look slightly squonk, if you like. Are they having trouble seeing in one or both eyes? Do you notice that they're having trouble walking, or they're getting dizzy, or they're losing balance? And in some situations where particularly a bleed in the brain can cause a sudden, very, very severe headache. A headache we call a thunderclap headache, like somebody's clapped you in the back of your head. That's how bad the headache is on the stroke. So again, just to repeat, it's a numbness or weakness on one side of the body. It's confusion or trouble speaking or even understanding speech. It's double vision or loss of vision in an eye. It's trouble walking or even, loss of balance, and sudden severe headache. So this is really the symptoms of a stroke, and the most common cause of people having stroke is uncontrolled blood pressure, which is why we're talking about it today. Frightening, huh?
Yes, it is. It gets me thinking, but I will share a little later on. You can continue.
Yeah, so I think it's really important to understand that when you notice these signs and symptoms, or if you know someone who's experiencing these symptoms, it's really important to seek medical attention immediately. Time is the essence. As the sooner the treatment is started, the less likely it is that there's permanent damage to the brain. We call it brain tissue, or brain time. And then once the brain tissue has been damaged, it's damaged. You can't actually reverse it. But if, for example, when we come to talk about the other causes of stroke, which can be a clot in the brain, we can actually dissolve that clot if you get to the hospital within 3 hours, where you can do a scan of the brain, you can see there's a clot there, can actually give you medication to clot bust that thing, and the blood supply is resumed. But the longer you leave it, the longer you delay to get to the hospital, the more likely it is that part of the brain, because the brain is really sensitive, will die, and then you're left with permanent disability. So it's really important to understand that you call 911 or whatever it is, or an ambulance, to say, come, I have somebody who I know is having possibly a stroke. And you'd rather be safer and wrong than right and too late. So this is really important. And like I said, the reason why we're discussing this is the commonest cause of death from stroke is uncontrolled blood pressure. And we see so much of it in our hospital that really it has become a public health issue, that blood pressure that is uncontrolled, because people, like we said last week, blood pressure is silent. It doesn't cause headaches or dizziness. So your only way to tell you have blood pressure is to actually measure it. And unfortunately, when the blood pressure comes down, people say, you know what, I don't feel any different. Maybe I'll skip my pills today. And that's what happens. And they skip 2, 3, 4, 5 days. Blood pressure begins to rise. And before you know it, they've had a stroke. So this is really important. Other causes, of course, are things like, which we're going to coming in our topics on the Broken Body series, are things like diabetes and cholesterol, drug abuse, alcohol. These can cause stroke, but the commonest one is uncontrolled blood pressure. Do you know somebody in your family who's had a stroke?
I suspect I'm the one that will have that because of the size.
I think some people will actually think when I get these numbers in my fingers, I get a headache. Sometimes my speech is a little bit. If you are somebody that is of a certain age group, beyond the age of 30, if you are already having blood pressure, if you're diabetic, if you're a smoker, and you're having these symptoms, it's best to go and check what's going on. It's very easy for a facility to say to you, know what, this is just X, Y, and Z, or you know what, we need to do a brain scan. So I think there are a number of things you can do to reduce your risk of having a stroke. The most important one, of course, is controlling your blood pressure, making sure that blood pressure is really well controlled any time of the day. It's really to emphasize people out there that please don't stop your blood pressure pills. Even in 2023, there is no cure for high blood pressure. You need to take your pills. Of course, other things like eating a healthy diet, exercising regularly, maintaining a good healthy weight, managing your cholesterol, taking your medication as prescribed by your doctor, quitting smoking. Everybody knows these things, but sometimes what is, I guess, common sense ain't common practice, and then we see it so often. And of course, if anybody's listening out there has had a stroke, and it's now, if you like, several days after the stroke, the treatment clearly will depend on what type of stroke you've had. If the stroke is as a result of a clot in the brain, we'll try and unblock it to see if we can actually salvage some of the brain, and this is by giving medication that are clot busters. If the blood pressure is the cause of this thing, we'll try to control your blood pressure, etc. So the doctors will decide exactly what to do. But again, before you ask any more questions, the complications of stroke can vary. Depends on the severity of the stroke and the area of the brain affected. The brain is a really complicated structure. If you didn't know, it's got something like 3 billion electrical wiring. So anything can be affected. It's a really amazing structure. So, unfortunately, some of the common complications are, and we see it sadly at even young age, permanent disability, where you see people who are unable to walk, are in a wheelchair, who are unable to talk, unable to communicate. And it's loss of productivity, it's loss of quality of life, it's loss of career, and it's a huge impact on the family that is looking after a stroke patient. So really something that prevention is better than cure.
Very true.
The worst complication of a stroke is death, if you like. And of course, the other things are, depending on the area, difficulty swallowing, difficulty speaking, difficulty walking, memory problems, all those sort of things, depression even. So it's really important. If anybody's listening out there has had a stroke, it's important to work with your doctor or your facility to manage your condition, and importantly also to reduce your risk of having another stroke. So this involves taking medication, lifestyle changes. So these are all important issues in terms of stroke. And again, going back upstream, controlling your blood pressure. Heart disease, is a collection of things. It's got to do with high blood pressure. It's got to do with cholesterol. It's got to do with some of the complications we're going to talk about next week, which are heart attack and heart failure and kidney failure. So it's really a powerful disease, which we're beginning to see increasingly in our country. largely because of lifestyle. So really prevention in terms of blood pressure, cholesterol, weight, exercise are the important things. And again, some of the tips for recognizing a stroke. Do you remember some of them?
Yes.
Tell me.
Please don't put me on the spot.
Well, I have an acronym, which basically means, we call it the FAST test, F-A-S-T. F stands for face drooping, A stands for arm weakness.
I wanted to talk about arm weakness. That's what I'm busy dealing with. Okay, let's continue.
S stands for speech difficulty, and T stands for time to call 911. So FAST, face drooping, arm weakness, speech difficulty, and time to call an ambulance. Tell me about your arm weakness.
No, it's not mine. Someone. when someone constantly has a pain on the shoulder, like where on the joint here, but this pain doesn't go away, but it's not as severe. And at the same time, it's like the arm gets very tired. What could that be?
That is more likely to be something what we call in medicine adhesive capsulitis, which is a complicated way of saying the old word was frozen shoulder. They're unable to elevate their shoulder beyond a certain level because it causes pain. And that's usually because the muscles around the shoulder joint, which is very complicated, are either becoming stiff or they're developing deposits in them. And the best way to determine what's going on with that arm is to do an ultrasound and in some situations an x-ray just to make sure. But it's certainly not a stroke. If it's sort of an ache more than a pain, it's more likely to be a muscular issue. Still needs attention. You know, one of the things we try and teach on the Broken Body series is don't treat the symptoms. Ask what is the cause. In other words, give you a Panado or a Miprodol for that pain in the shoulder, and the pain will go away. But if the problem is not attended to, then
definitely the pain will come back.
So always ask the doctor, what is the cause besides, getting some symptomatic treatment for your heartburn or whatever it is. What is the cause of the heartburn? Usually heartburn, for example, is caused by eating too much processed starch. The shoulder pain may be because of age. It may be they have other arthritic conditions. It may be because of gout. It may be because you've torn something in the gym. So ask yourself what's caused it before you actually address the symptomatic treatment. And that really is important so that you prevent it from happening in the future. So that's, in terms of that shoulder pain, I'd probably likely say it's definitely not a stroke unless the patient has other symptoms like numbness in the hands, etc. So wouldn't worry about it too much, but get it attended to. But definitely.
Yes, definitely. You were saying
that's definitely the topic of today's, and the take-home message today is: if you've had these issues we've talked about, again, just to repeat out there, it's face drooping, arm weakness, speech difficulty, and T means time to call somebody. Yeah. If you see somebody showing any of these signs, you need to act fast and call 911 immediately, because every minute counts and don't delay. It's really important. This information is helpful for those out there that are listening to this program. And remember, stroke, the commonest cause of stroke is heart disease, and the commonest heart disease we see in our country is high blood pressure. Next week, on the Broken Body series, we're going to be talking about, and end the series on heart disease, we're going to talk about other complications of uncontrolled blood pressure, which are heart failure, heart attack, and kidney failure, all really serious problems, which we see, unfortunately, in a younger and younger group in our community, and people need to sort of stand up and pay attention. It really is important.
All right. I wanted to ask before we part, when someone doesn't have any issues with their blood pressure and they are experiencing all the other symptoms that we were talking about, is it also advisable for them to get themselves checked out, or they just address them one by one and rule out the stroke?
If you're listening and you've got any of these symptoms, it's just worth getting an okay from the clinic or the doctor or the facility that you're going to say, I have these things. Is it something serious? And they will look into it. They will check your blood pressure. They'll check your cholesterol. They'll listen to your heart. They may do some other tests. And if they say, look, all things are okay, this is probably something mild and it'll pass, at least you've got reassurance. But don't sit on something to say tomorrow it'll get better.
Okay. Thank you very much. If someone is listening or someone has just joined us and they missed out on a lot and they want to get a hold of you, how can they?
The best way is to log on to our Facebook site, which is the Heart Foundation of Botswana, and it's open to everybody. And just be a friend of the Heart Foundation of Botswana on the Facebook site and ask your question, and we'll always have it answered.
Okay. Any last words?
Cool. No, nothing else. Just remember the FAST acronym. I hope you remember what I said in terms of Facebook. And we'll see you next week. We'll talk about some of the last complications of heart disease before we move on to the second topic. Okay.
No, thank you so much. Hopefully we'll meet again soon, right on the same platform.
All right. Cheerio.
All righty. Thank you. There is Dr. Kiranvi Bhagat of the Cardiac Clinic and Village Medical Day Care talking to us about the stroke as one of the causes of heart diseases, and he explained further and explained a lot concerning that. If you should have questions, he has cited to you that you can join them or follow them on Facebook to get clarity on all of that. 10:48 is our studio time. RB2, your station of choice. 1 or 2 songs on the other side of that. I'll be playing 3 songs from one artist.